Sabin Nsanzimana, thank you so much for your time. Let's start it off with the question, why did the authorities make face mask wearing mandatory at this particular time?
Yeah, so the fight against COVID-19 is evolving. Every day we are seeing new strategies that are working. So initially we didn't see that it's necessary to have masks distributions because we didn't even have masks for everyone. So we're making sure that those on frontline, doctors, nurses, have enough protection. At that time we had 1 or 2 cases. So now we are talking about hundreds of cases. And we're also thinking about people who will be moving around probably in a few days to come. And what can we do to make sure someone who is sneezing or coughing doesn't spread these droplets of the virus to others. So masks can be helpful, although they don't protect 100%. But still, if everyone has a mask, there's additional community protection. It's the same like you're sneezing, you're using your elbow. So it's the same. If you have a mask, then the droplets will not spread.
How effective are locally made masks?
So we're estimating about 50% individual protection. But if everyone is having masks, this could even go beyond this heavily or the highest category of masks, the standard of 95% protection, which is usually a doctor or a nurse on duty used masks. It's not a mask that everyone will be having on the street.
So what does it mean to have more recoveries than active cases in Rwanda? Because if you look, I saw the statistics, we have over 70 recoveries. What does that mean to have more recoveries than active cases?
So this is an interesting indicator because the more people entering hospitals actually, and the fewer exiting is a problem because your health system will be overwhelmed. And when you see more people exiting hospitals, recovering, returning back to home, and the fewer entering the clinic settings, then you have easy maneuvers to control or to implement other strategies. So for the health system, it's good news. For the public health context, you need to be careful and continue to be on alert and see, is it that we are saying having fewer cases, or does it mean that people are getting sick, probably are in one category, and we should be preparing for other categories who will be severely affected? So all this, on one side, is something good. On the other side, it's raising questions, and we should be not dropping our weapons, should be always be careful and see what else can we check. It's not one indicator that will tell you, okay, you're doing well. So you need to put together several indicators. It's like how many people do you test, how many positive do you find? When you find one positive, how many connections and contacts? So we have a series of indicators to watch before we say that good news. So we are not yet there.
I don't know if you can respond to this, but what does this 11 additional days of lockdown mean to Rwanda's fight against coronavirus?
We've been seeing new cases every day. There's a day we got 17 cases. The day we got 13. But nowadays we're getting less than 10, generally less than 5. If this trend continues, then we'll be going in the right direction. But things are changing so rapidly that you could see more than that. But we hope that as people stay at home and we continue to find, isolate, test, and treat, we may go in a period where we see like 2, 3, 4 days without new infections, without new findings. Findings means the positive case confirmed. Then that time we could say maybe we've identified all the clusters of infections, and then lockdowns is for us like an open window or an easy space to operate as epidemiologists, frontliners, before we overwhelm our health systems. So the worst case scenario would be people move as usual, then hospitals will be overwhelmed, then there's chaos and panic, as we've seen in some countries.
Lastly, Dr. Sabin, there are some concerns about delayed mandatory wearing of masks, but there's also concerns about the prices. 500 Rwandan francs, is that reasonable enough?
So about delay, I don't think there's a delay. I think you place or you implement a strategy depending on where you came from and where you're heading. So now we're talking about a situation where we have fewer new infections, we are controlling, and we are getting ready for our next phase. Let's say tomorrow, people will be moving in mass. The lockdown will be ending. What can we prepare now for that time when the lockdown is over? So having these masks for everyone implemented now, preparing for tomorrow, is the best thing we can do. So it's not too late. It's actually a timely decision that we should all support.
And the prices?
So now the price. I don't think the price is really high because we know how the masks cost, and sometimes price goes with standard, and we don't want to approve substandard products. So standards, the health has a lot of cost. There's no even cost for someone's health. So having these standards and having a reasonable price that someone can afford, and those who can't afford can be supported to afford it, is, for me, a fair balance. So we'll see how many people will need to be supported. As we speak, there's so many solidarity happening here in Rwanda, on food, on transport, on communications, in many ways. But we don't ignore that there are so many other people who will need to be supported to access this important tool to protect for their health, but also to the community health. And I think the government is looking into all those options.